call a bit faster than I would normally pace my treatments so that we can get all of this in a quick manner, so we're not taking up too much video space as well. And we've been through this a few times, so yeah. Warming our hands, warming our hearts. At this point, we would recite the Na'a, Nawa, Roka, Paiti, Lena Santi, that part of the Y crew. You can always say that in your head, but you can say it out loud and inform your clients about what that is if they're interested in receiving prayer before you work. Place your hand on the feet and start with your palm walking. And again, I'm only going to do a few passes and I'm going to move through a little quicker than I normally would. Make sure that you're keeping your bamboo rock or your tie swaying. Palm press simultaneously, just leaning in, observing the ankles, the knees, and the hips. Scoop the heels, bring them in, your knees widen so you have space. You're going to rock up and over, drop your hands and the weight on the dorsal part of the foot, plantar stretch for 1. Find a second location that feels comfortable for 2. And back to the first location. 1. And then we're going to dorsiflex. Toes up to the sky. At that metatarsal phalangeal joint, you should see the head bob and rotate one direction. Head bob, rotate the other direction. Head bob, and we're going to jostle. Looking for areas of restriction and areas of movement. Go ahead and separate the heels. Medial rotation, toes kisses toes. You're going to rise up again for 1. Rocking your shoulders past your hands for that traction or backward stretch, we call it. 2. And back to 1 again. Nice long arms. You'll see the stretch ripple all the way up to the hips. Externally rotate. Palm walk. And palm press. Leg up. You want to get yourself into position. Fold the knee. Flex the knee. Your foot should be outside the torso, just outside the rib cage. For their straight leg, you want to take your hand and lock their leg down to the mat. For those of you who are not as flexible, or clients who, if their leg is basically popping off the mat, then this compression might be too much, so just be mindful. Knee to shoulder on the exhale. When your client is emptying their hara, knee to shoulder. Release. Your foot is going to pivot on about a 45-degree angle so that your client knee drops, and we do an inguinal stretch for 2. Rock back. Your foot right alongside the torso again for knee to shoulder for 1. For that hip stretch. We're going to rotate now the leg into external rotation, or hip into external rotation, butterfly palm. And I'm going to take a lunge stance here. Your hara should be opposite their hip, aligned with their knee. Butterfly palming, rocking your shoulders past your hands again to roll the opposite hip towards you. Opening the hip and compressing along the adductors. You want to work all the way up to the inguinal crease. And hopping back down to the knee. And when you get to the knee, crisscross applesauce, bilateral stretch, knee and hip. Take your time here. This can be really deep for some. And then we're ready for our hip. Compressions, downward pressure right into the adses. And now we're ready to walk down the legs. Walk and hop. Once you get to the knee, we're going to hop down gastrocnemius, making our way to the heel. Arch. And then back to the heel again. We're going to do a counter stretch to the external rotation. We're going to bring them into a spinal twist. Make sure that the bolster is at the level of the hip, the top part of the bolster, and the bolster is right alongside their opposite leg, and roll them over onto that bolster. You want the knee and the hip in this 90-degree line and angle, so make sure that the hip and knee is aligned, and that the hips are stacked, and that the shoulders are stacked. That's for best alignment. And then we're going to go ahead with our elephant compressions. My elephant trunk, compressions into the IT band. Working all the way to the TFL. And you can do multiple passes, as many passes as your client needs. When you make your way back up towards the hip and the glutes, I'm going to do my forearm compressions into the TFL. So I'm going to palpate and feel for that iliac crest, where the posterior iliac crest turns into the anterior iliac crest. Right off of that bony landmark is where my tiffle is, TFL. Compressions there. And to pump it, make nice. And you can expand that workout from the center, from the TFL, working into glute med, working into glute max, tracing around the greater trochanter, all the way into the deep 6 piriformis and the other ones. Okay, we're going to go ahead and do our compressions into the laminar groove. I'm hooking into the soft tissue here, into the laminar groove, and then I'm going to compress straight down into the mat, using my lunge leg to stabilize my arm, to support my arm and my compressions. So it's coming from my center, not just from my hands and my shoulders. And so we're going to do a few passes, right? Up, down, back up again. And then we're ready for our shoulder mobilization. I'm going to go ahead and take a kneeling stance and half lunge stance. Mobilize the scapular and glenohumeral joint. Pressing into the pecs and pressing into the scapular rhomboid area. Interlace the fingers. Make sure that the shoulder is aligned with their elbow, aligned with their hip, towards the feet. Traction. And you can do that 3 times. Really good if there's any type of medium nerve compression, ulnar nerve compression, brachial plexus, TOS type of conditions popping up, showing up for your clients, and pain throughout the trapezius, SEM, and levator scap. And so now we're ready to bring the arm alongside the client. And we're going to squeeze and walk and compress the lateral arm. Make sure you're rolling and leaning forward with your body and dropping your body weight, not just working with your arms. And we can do a few passes up, down, up, down, up, down. And then I'm going to open the palm, but my palm spreads. Spreading along the dorsal part of the hand as well. You can do some finger toms if you like, traction. Creating space in the joint here. And now I'm ready for my finger slides. Bend the elbow. And however your client's hands fall, I'm just following that natural rotation and supporting my client. Finger slides all the way to the fingertips. Out through the palm. So that we can prep for that really deep palm stretch that we're going to do in just a minute. So make sure it goes all the way out, not just up to the ceiling, but out behind them. Thumb to thumb, we're going to interlace, mobilize the wrists, and the claw. So our fingers are going into that interphalangeal joint right there. And traction. And then the other way, mobilizing, rotate, and the claw. Slide out the fingers. Deep palm stretch. I'm following the natural curvature and bend of my client's wrists. Wherever their mobility is where I'm going. And now we're ready to do our inverted palm stretch over our client's head. You want to lock here. You really want to make sure that the elbow stays aligned with the axilla as much as possible, aligned with the rib cage, aligned with the hip, right? That's how you're going to get the best stretch for this lateral compartment that we're looking to stretch here. Triceps, a little bit of teres major, serratus anterior, the upper portion of latissimus. And then you're ready for your hook and pull. I'm going to use my foot to lock down their hand. And I'm going to do some hook and pulls here. Kneading and releasing any tension in the elbow at the insertion point of triceps, biceps. Kneading. Release, jostle. Compress at the insertion of pec major. And do some rotations. We'll do 3. Third one. Rest the hand at your client's side. Lock the leg, their foot behind their straight leg, and then you're going to lock that foot down towards their straight leg. I'm going to hold on to the hip handle here and rock the leg open and rotation, hip mobility. Circling the knee over the hara, keeping the knee in 90. Don't let it come out in 90. You want them to release, not hold. So we're disrupting any holding patterns, and then also feeling for anywhere in the body where there may be tension. Bring the leg down, support, traction, jostle, and moving on to the other leg. We're not going to record the other leg. All right, we're going to start. I'm going to have my client come. Essentially, you will have a bigger mat and bigger floor space to do this, but you want your client to come to the edge of the mat. The side that you're rolling to, you want to make sure that that arm is up and out of the way, overhead. And just place it there. Same side of the body for the arm and leg. And roll your client to you. And then hop into the middle. That's the transition to prone. Fun times. I'm going to rotate the quads and the hamstrings here to protect the knees. And then you can do your feet walking. Go walk on the feet. Using all aspects of your feet. Your toes. You don't want to compress into the calcaneus. Don't do that. What happens is that it compresses and it can feel uncomfortable as the calcaneus hits the talus and the other what do you call those? The cuneiforms, and you can use the heel. Use all the things, all the parts. Play around with dropping the pressure. And the wider base you have, the more balance you have. So if you're too close and the hips are too narrow, that's going to reduce your ability to move around from a place of stability. Walk the other foot. You can compress up the medial part of the leg, opposite leg. You can compress into the glutes, work and walk and compress over the opposite leg, so across the body. So trying out various different ways, seeing which ways feels most comfortable and supportive to you. Okay. And you essentially do that up and down the body as many times as needed. But we're gonna move on for the sake of the video time. I'm gonna bring my client's knees into flexions. Heels are gonna go towards the glutes. I'm gonna use my knee to open their leg and take that foot and bring it in and fold it into their calf. I'm gonna come to a lunge, and this is the water pump of the legs. I'm gonna compress into the hamstrings and the lateral compartment about the IT band, and bring the heel to the glute. And again, heel to glute, heel towards the glute. Pumping and releasing, compression, pump, release, compression, pump, release, compression, pump, release. All right, awesome. Same. This knee is going to pop out with my knee. Lock that foot. Compressions. Water pump of the legs. Heel towards the glute, compress, release. Heel towards the glute, compress, release. Heel towards the glute, compress, release. Working up and down, all the way up to the hip, all the way down to the knee. Many passes as needed. Release, jostle, rotate. We're going to do some gorilla walking into the glutes. Just to warm the glutes up a bit. And again, I'm moving a bit faster than I would in a normal session. Glutes, we're going to take a squat position in between our client's legs. And then we're going to kneel into our client's glutes at the same time. That way the weight is distributed evenly and the pressure is not too much. We're going to rise up, frame our client's head, one hand behind the head, one hand in front of the face. And then we're going to start with our running man. Party time at the glutes. And then we can do our windshield wipers. It's okay. Okay.
I have that.
Someone always laughs. You guys always laugh over there with the glute work.
We got it.
And then I'll squeeze.
Share it. You gotta share it.
It's my fault.
She did it.
It's okay.
After we do our glute squeezes, then we're ready to walk the back and warm the back up for our deep back extension, spinal extension. Palm walk up and compress down. You can definitely take the elephant stance and straddle the client and work this way as well. You don't have to stay in a kneeling position. When you get up to the level of the scapula, you want to make sure that the pressure or the movement, the body weight distribution, shoulders are going over the hands so that you're tractioning and opening up the cervical spine versus compressing into the cervical spine. And after you warmed up the back considerably, now you're ready for your Cobra. We're going to demonstrate both positions. Now that I'm standing up, I'm just going to go ahead, walk to my client's shoulders, pick the shoulders up, place them over my feet, and then I'm going to take a seat. So I'm taking a seat at the sacrum. Is that okay? Right? Not really at the lower back, at that sacrum. If it ever feels uncomfortable, you can always add a towel or a pillow here as a buffer as well. I'm going to go ahead and bring my knees open just in case my client has really tight shoulders to support me bringing the arm in towards my hips. I'm going to have my client hold on to my waist. And I'm going to, for my client that I have here, the body that I have now, I'm going to wrap over top. Sometimes you need more support, so you may want to come around laterally and scoop up. Take a deep breath in, prompt the breath. This is a deep stretch. Take your time. Don't yank the body up. Guide it up. You don't want to lock.
You actually got it
Someone's
perfectly, so to be honest, I kind of want to stay here one second.
You don't want to create any protective spasms. Okay. I'm going to demo the other Cobra. Are you okay to receive that?
Mm-hmm.
Okay. We're going to take the kneeling stance in between our client's legs again. Kneeling into the glutes. Hold on to my wrist and hands. I'm going to rise up first. Prompt my client's breath second. And on their exhale, lean back. And release.
You felt it too there, yeah. You felt that too.
All right. Counter stretch for our Cobra. Our back extension will be child's pose. Let me have you come up to child's pose on your hands and knees. All right. Guide them. And then you can do some really nice compressions, bilateral compressions at the scap and sacrum. Open up that lower back. Release any tension. That may be there, especially from that deep back extension. Okay, so if you have the control and you have the core strength, you're going to take a seat at your client's sacrum, lower back, the sacrum, close to the tailbone. I'm going to go ahead and spiral my body down. I want to go into prayer position. She's going to pull at my wrist so that she's stretching me, giving me a nice shoulder stretch and psoas and ab. And release. And we're both going to come up together. She rolls up, I roll up with her.
You come down a little more.
And then we take a beautiful picture. Okay, I'm going to have you roll onto your back. Alright. I'm like almost in like a forward fold. Traction and support your back. Into your hara, I'm going to place the feet about where my waist is, and then depending on the size of your client's feet, you're going to have to play around with this position. You might have to bring the feet out laterally. And I'm going to place their feet into my hara, toes going in towards my diaphragm. So I'm doing some Wingate work for myself here. Abdominal compressions, and that feels great for me. Okay, release. You're going to take your knee, drop your client's knees so that they can go into happy baby. Make sure that you're only holding at the heel,
That was good.
right at the heel, so that you can allow for the knees to drop back and the hips to open all the way. Beautiful. Bring your toes to the edge of the glutes, so the ischial tuberosity, I can just see my big toe, barely see it. Crisscross. Fold into lotus position, and you want to lock that lotus position underneath your knees. And so I'm bending my knees in towards my client and locking them in with a little bit of a forward push. Go ahead, hold on to my arms. I'm going to sit back as if I'm going into chair pose. As I roll them up and round my client up, I'm going to go ahead and extend my knees and jet my hips out. And then we're playing with this counterbalance here. I'm going to roll her down. Deeper stretch, triceps, biceps. Same idea. As I roll her up, I'm pushing my knees to lock her, and then I'm going to go ahead and straighten. Transition into seated, back to the forearms, pull and round your client up, and then you're going to take 2 steps back. Interlace the fingers, chicken wing, chicken wing. Lock the hand behind your back. I'm going to stand in a side position. The side of my leg is going to basically really support the back, the spine. I'm going to push into the spine so that they can have a counter balance and a counter pressure. This will deepen the stretch as well if your client needs it. Opening at the elbows, you could come in towards the triceps. Stretch a little bit deeper. You can pull up at the triceps. And if you need to deepen the stretch for your client, if they need a deeper pec stretch, just push your hip and your legs deeper in towards the spine. Release. And now we're ready for our neck squeezes. So you just did chicken wing, you're gonna do your chicken wing. You're gonna make sure that you're not out too lateral. If you're by the ears, you're out too lateral. When you scoop up, you're gonna scoop up skin and you're gonna choke your client. So you wanna stay posterior, okay? So behind the mastery process. You would do that as many times as needed. I'm going to come to a lunge. The same leg that is up, I want to do my compressions on the same side so that my leg is supporting the weight. I'm going to place my client into a lateral flexion with my hand supporting on the other side, the opposite side. You can also hold the head if you need. I'm going to do my forearm rolls. No tension in the wrists. And I'm using my body, leaning into the rolls. It's not coming from my shoulder and my arms. Mainly coming from my body. And then you're ready for your compressions. 3 points. Coming into the soft tissue just outside the acromion. Hold for 3 to 5 seconds. 5 to 10, whatever's needed. Start with 3 to 5. To GB21, to the base of the neck, right, working along those transverse straps, back to GB21, which is at the mound of the traps, back towards the acromion, in the soft tissue. Release, forearm rolls to relax. I would do the same thing on the other side. And after we do the same other side, and then we're ready for our water pump of the arms. Or water pump of the arms. I'm gonna go ahead and ask my client to give me a hand shake. I'm gonna place their elbow in line with their shoulder. I'm gonna bring my elbow just inferior to those transverse tracts, so just before the superior angle of the scapula. And then I'm going to push my elbow into my client's body. I'm trying to bring my elbow up towards the ceiling, and as I push the elbow into the body, their arm is gonna raise. I'm gonna go ahead and allow for my hand to bring the arm all the way in so I can push even deeper. You should see your client's back do this undulation. That's what you're looking for. Release. I'm gonna slide my arm back just a tad bit, and that's going to bring me to my second point, which is gonna be right along that medial border of the scap, just below the superior angle of the scapula, right into rhomboids. Release. I'm gonna come back just a little bit more, and now I'm gonna hit that inferior angle of the scap. Again, pushing in with the elbow. This is what you want here, leaning your body in. And release. And then you can do those points going back up. I'm gonna take the hand, wrap it around, and lock it on my client's arm. And now I'm ready for my spinal twist. Nice long arms. I'm gonna lock my arm first in extension. And then I'm gonna pull the opposite arm, and I'm gonna look over my shoulder. So I wanna make sure that my arm isn't here when I'm doing my pushing. Nice long arm. And rotate at the same time. Working up and down the back. And once I look over my shoulder, that's my rotation. Spinal rotation is gonna help me deepen their spinal rotation. Okay, looking good, people. Release. I'm gonna have my client put their their hands over their ears, and I wanna really make sure that the fingers are pointing towards the ceiling. This helps to stabilize this technique. I'm gonna come around to the side of my client. My front leg is gonna be straddling or in front of their knee. My back leg is gonna lock my clients down towards the mat. This is stabilizing also as well. Have your client hold on to your tricep biceps. I'm gonna open their elbow, open up the pecs first. And then I'm gonna push my client into lateral flexion as I pull their arm to me. So it's a slight spinal rotation, more of a lateral flexion. Amazing. And then bring them back. Same other side. Oh, go ahead, I'll do this right.
Yeah, it's a good one, right? So make sure you do your lateral flexion. Tie your trapezius into a bow. Release. Into a bow one more time. Release. Into a bow for the third time. Release. Shoulders go up to the ear. Drop. You can do that multiple times. And now we're ready for our quacking. It's a signature tie supportment technique. You gotta hear the quacking sound. And as you see, and as you hear, I should say, everybody had that quack down. Wipe, brush, hold for meta touch before you say goodbye. One last moment of silence, attention and care before you seal the treatment. Kap kun ka or kap kun krap. Thank you. That's everything.